The next topic is the arterial supply of the nervous system. If you're talking about the arterial supply of nervous system, let us look at a question, and that question is asking us about labyrinthine artery. Actually, labyrinthine artery is going to supply the inner ear and is a branch of. Actually, this question has double answer. Most of the patients, most of the individuals, 80% of the population actually. So 80% of population, it will be a branch of anterior inferior cerebellar artery. Yes, which itself is a branch of basilar artery. So you're telling that 80% of population, the labyrinthine artery supplying the inner ear is a branch of anterior inferior cerebellar artery, which itself is a branch of basilar artery. Yes. And 20% people, it is a direct branch of basilar artery. If you say 20% people, it is a direct branch of the basilar. Do you mean to say double answer? Yes, but C is better than B. Why C is better than B? Because 80% is better than 20%. Most appropriate answer. It is just like, a case of fever has come. And what is the differential diagnosis? Mostly, I'll say viral. But cannot it be typhoid? Yeah, maybe. Can't it be the malaria? Yeah, maybe. So like that you write in your case sheet, isn't it? One query, viral, because this is most common. And double query, typhoid. And triple query, malaria, less common. So like that, most appropriate is viral fever, though it could be typhoid. So similarly, the answer is C. Yes, C is better than B. Actually, both are correct. But examiner is trying to find out whether you know your differential diagnosis or not. Okay, let us now look at the details of circle of Willis. When you're talking about circle of Willis, you will see this circle of Willis is at the base of the brain. And when you say circle of Willis is at the base of the brain, it is contributed by two arteries. The anterior artery is the internal carotid artery and the posterior artery is the vertebral artery here. So you are telling that at the base of the brain there is a circle of Willis, yes, and contributed by anterior. See, this is the internal carotid artery which is anterior, and there is a vertebral artery which is posterior. Let me magnify the diagram and then show. You see here. This is the anterior, which is the internal carotid artery, and this is the posterior. There are two vertebral arteries, of course, one on the right side, one on the left side. Then they join to form the basilar artery, and then basilar artery divide to form posterior cerebral artery, and posterior cerebral artery communicating with the branches of internal carotid artery, and that is where you have circle of Willis at the base of the brain. So, can I see the circle then? Yeah, you will see, but remember that two vertebral arteries will be joining to form the basilar artery, will be bifurcating to form the posterior cerebral artery, and will be communicating with the branches of the internal carotid artery, making the circle of Willis. This is more anterior, that is internal carotid artery. Internal carotid artery will give some branches also like anterior cerebral artery and middle cerebral artery. Then who is giving the posterior cerebral? That is by the basilar artery. So these diagrams we'll see later also, but remember there will be one anterior cerebral artery which is branch of the internal carotid artery. Then there will be a middle cerebral artery, branch of internal carotid artery, but the posterior cerebral artery is a branch of posterior cerebral artery is a branch of the basilar artery is a branch of the vertebral artery. So this is some discussion which we are going to do now, and here is the base of the brain. If you say that is the base of the brain, that is where we have the circle of Willis? Yes, in the subarachnoid space. So circle of Willis is in the subarachnoid space. What if I have berry-aneurysm rupture? The berry-aneurysms which are in the circle of Willis, if they rupture, then of course you will have subarachnoid hemorrhage. CSF is mixed with blood. Understand, circle of Willis is in the subarachnoid space, and if there is a rupture of berry-aneurysm in the circle of Willis, then there will be subarachnoid hemorrhage. The CSF is stained with blood. Can we magnify the diagram here? Yeah, let's do that. See, I'll still magnify. you will find that there is the two vertebral arteries and they are joining to form one basilar artery which is at the base of the pons. Remember, these two vertebral arteries, they are going to join and form the basilar artery at the base of the pons, on the front of the pons. And what is the basilar artery doing? That basilar artery is bifurcating into two branches. What is this two branches? That is the posterior cerebral artery. But before it gave posterior cerebral artery, it would have already given superior cerebellar artery. So you are telling this is the basilar artery which would have already given superior cerebellar artery to cerebellum? Yes. Actually, you have to understand that there are other branches also, like you will see. Anterior inferior cerebellar artery. So that is anterior inferior ICA. Yes, ICA, anterior inferior cerebellar artery. So anterior inferior cerebellar artery is a branch of the basilar artery. Yes. Then who is giving pica? Pica means the posterior. Yes. Okay. Posterior will be given by the vertebral artery itself. So posterior given by vertebral artery like this. Yes, like that, like that, like that. Actually, we'll make a diagram and then discuss, but it is a vertebral artery which will give pica, posterior inferior cerebellar artery, and who is giving ICA? That is given by basilar artery. If you say so, fine, fine. What is the next thing? Next thing you can see here now. What? That this is the posterior cerebral artery. And what is it doing? Can you see the internal carotid artery here? Where? You can see the internal carotid artery here. If that is the internal carotid artery, what is it doing? I told you. It will give anterior cerebral artery. Yes. It will give middle cerebral artery. Okay. So you are telling that this is the internal carotid artery giving anterior cerebral artery there? Yes. And middle cerebral artery there? Yes. And who is giving posterior cerebral artery? That you already have given. Who is giving? Basilar artery, which is itself by vertebral artery. So vertebral artery from basilar artery from the posterior cerebral artery. Yes, posterior cerebral artery. And then you will see internal carotid artery is giving what? It is giving this posterior communicating artery, which is communicating with the posterior cerebral artery. You are telling internal carotid artery gave you posterior communicating arteries communicating with the posterior cerebral artery, now making the circle of Willis. Yes, circle of Willis. This is the interpeduncular fossa. Why would you say this is interpeduncular fossa? This is interpeduncular fossa because this is the peduncle. What peduncle? This is the peduncle, cerebral peduncle, not the cerebellar. Cerebral peduncle in the midbrain. So that is some cerebral peduncle in the midbrain. Yes. So this is interpeduncular fossa. Yes, interpeduncular fossa. There you have mammillary body also. Can you see? Mammillary body. So this is mammillary body in the interpeduncular fossa, and that is where you have the circle of Willis. Yes, in the subarachnoid space. So this is what we want to discuss. Now, you want to look at the base of the brain and discuss the circle of Willis in the subarachnoid space and in the interpeduncular fossa. Let us first draw this part of the diagram. But before you draw this part of the diagram, you have to look at the details first, then you draw. So as we have said, there are two vertebral arteries. They ascend up to enter the cranial cavity. How? By passing the foramen magnum. So they are going to pass the foramen magnum. Yes. To enter the cranial cavity. Yes. So there are two vertebral arteries which will enter the cranial cavity passing the foramen magnum. What they will do after that? They will join to form the basilar artery at the base of the pons, on the front side of pons. So on the front side of pons, you have the basilar artery. What is this basilar artery doing? Basilar artery supply the pons. And it is giving the ICA. What is ICA? Anti-inferior cerebellar artery, which is now giving the labyrinthine artery in 80% population. That was the question. Question was, labyrinthine artery is a branch of? You said ICA. And ICA is a branch of? That is a branch of basilar artery. And in 20% people, the labyrinthine artery can come directly from the basilar artery itself. See, this basilar artery is also giving what? It is also giving us the superior cerebellar artery. If it is giving the superior cerebellar artery, fine. Who is giving the pica? Pica, yes. You see here, pica. This is pica. You mean to say pica is given by vertebral artery? Yes. It also give two anterior spinal artery, which later become one anterior spinal artery in the midline. You are talking about the branches of vertebral artery now? Yes, they are one pica on each side and one anterior spinal on each side. So later they join to form one anterior spinal artery in the midline and supply anterior 2/3 of spinal cord. If you say it is supplying anterior 2/3 of spinal cord, then who is supplying the posterior 1/3? Posterior 1/3, of course, will be supplied by posterior spinal artery. And who is giving the posterior spinal artery? That is also usually given by vertebral artery. So you are telling that this is the vertebral artery, yes, and it will give two posterior spinal arteries, yes, and two anterior spinal arteries, yes. It is the vertebral artery which will give two posterior spinal arteries and two anterior spinal arteries, four spinal arteries, yes. Vertebral artery give two anterior, two posterior spinal arteries, total four spinal arteries, and supply the spinal cord. But anterior 2/3 of spinal cord is supplied by anterior spinal arteries, which have fused in the midline to become one anterior spinal artery here. And there are two posterior spinal arteries there, supplying posterior 1/3 of spinal cord. Okay, what is the next thing to discuss? Next thing is this basilar artery, yes, is supplying the pons, yes, is now bifurcating into two branches. What? That is called as the posterior cerebral artery to supply the posterior cerebrum. And this posterior cerebral artery is receiving a branch from the internal carotid artery. What is that? That is the posterior communicating artery. So posterior communicating artery is a branch of the internal carotid artery contributing to circle of Willis. Yes, circle of Willis. A question came, if you have an aneurysm on posterior communicating artery, then which is the most commonly damaged nerve? If I have berry aneurysm, yes, berry aneurysm on the posterior communicating artery, which is the most commonly damaged nerve? Oculomotor? Yes, oculomotor nerve. Let us see why that is the answer. And we draw the diagram. So we draw the same diagram. Yes. Okay, then let's do it. See, this is the midline of the body and front view of the brainstem. So then you have to talk about the three parts of the brainstem, which are midbrain and the pons and the medulla oblongata. So this is midbrain and the pons and the medulla oblongata for the brainstem. Yes. And what artery you are talking about? Actually, I have two vertebral arteries ascending up. If these are the two vertebral arteries, they are ascending up, then what are they doing? Now, they have to enter the cranial cavity, passing the foramen magnum. So, these are the two vertebral arteries which are ascending up now to enter the foramen magnum to enter the cranial cavity. Yes. When they enter the cranial cavity, they are at the lower medulla. You mean to say lower medulla is in the foramen magnum? Yes, it is the lower medulla which is in the foramen magnum, and that is where the vertebral artery will enter the cranial cavity and unite at the pontomedullary junction to form the basilar artery, where at the base of the pons, front side of the pons, supply the pons. So, telling there are two vertebral arteries which will be uniting at the pontomedullary junction. Yes, to form the basilar artery at the base of the pons. Yes, and what is this basilar artery doing? It will supply the pons. Not only it will supply pons, it will also supply upper medulla. And not only it will supply upper medulla, it will also supply midbrain. You are trying to say that this basilar artery is supplying not only the pons, but it is also supplying midbrain? Yes. And it is also supplying upper medulla? Yes. By giving some branches? Yes. What branches? So let us look at the branches of the basilar artery. But before you discuss the branches of basilar artery, you discuss the branches of vertebral artery. So what are the branches of vertebral artery? You remember we have told that there is some pica. Pica, yes, pica. Posterior inferior cerebellar artery supplying cerebellum. Yes, remember pica, which is posterior inferior cerebellar artery supplying cerebellum, also supply lateral medulla. It also supply lateral medulla. Now, if it is also supplying lateral medulla, what will happen if I have occlusion? Occlusion of pica. Then you will have lateral medullary ischemia, resulting in Wallenberg syndrome. So you are having occlusion of pica now? Yes, branch of vertebral artery. And then there's lateral medullary ischemia? Yes. Wallenberg syndrome? Yes. But have you read Gray's? Have you read the Harrison medicine talking about Wallenberg syndrome? What is Harrison telling? Let us see what is Harrison telling. Most cases of the Wallenberg syndrome are due to pica occlusion or vertebral artery occlusion. Vertebral artery occlusion are more often and pica occlusion are less common. You are trying to talk about Wallenberg syndrome? Yes. Okay, so vertebral artery is more responsible when it is occluded. There is Wallenberg syndrome. Yes, actually a question came like that. So let us continue with our diagram. As you're continuing with the diagram, remember, it is mostly that the vertebral artery is occluded and less often the pica occlusion leading to Wallenberg syndrome. So whenever a question comes, Wallenberg syndrome is due to, you should answer, most cases are due to occlusion of vertebral artery and few cases could be due to occlusion of pica. Okay, if you say so. What about the medial medullary syndrome? Medial medullary syndrome, yes. Okay, I'll tell you. See, there are two anterior spinal artery. Later they join to become one anterior spinal artery. So you are telling that in the beginning there are two anterior spinal arteries? Yes. And then they join to become one anterior spinal artery? Yes. And they are branches of vertebral artery? Yes, they are. So vertebral artery is giving two anterior spinal artery to join become one anterior spinal artery, supplying how much of spinal cord? Anterior 2/3 of spinal cord. Now, if anterior spinal artery, which is one in the midline now, is supplying anterior 2/3 of spinal cord, fine. What will happen if I have occlusion here? Where? In one of the anterior spinal artery. If you have occlusion in one of the anterior spinal artery, then you'll have medial medullary syndrome. Medial medullary syndrome. So medial medullary syndrome is due to occlusion of anterior spinal artery. Yes. Some cases are like that. So there is block in the anterior spinal artery now leading to medial medullary syndrome. Yes, it can happen. Okay, can you tell me who is giving ICA? ICA, yes. Actually, pica was given by vertebral and ICA is given by basilar. Can I see ICA then? Yeah, okay, you see the ICA. These are the two ICAs. Now, if you're telling these are the two ICAs, anterior inferior cerebellar artery, I think ICA gave you the levanthine artery. Yes, that was the point. 80% population. So now remember, this is basilar artery, which is giving two ICA, one on each side, anterior inferior cerebellar artery. And it is the ICA which gives levanthine artery. Levanthine artery is a branch of the anterior inferior cerebellar artery in 80% population. 20% people come directly from the basilar. And what else the basilar is giving? Basilar is also giving two. Superior cerebellar artery. If you give superior cerebellar artery, one on each side is a branch of the basilar artery. Remember, it will supply cerebellum, but it does not supply the medulla oblongata. Is a question. So you're telling that superior cerebellar artery is not supplying the medulla oblongata? No. Then who is supplying the medulla oblongata? Whatever you have discussed till now. What I have discussed till now. 11 arteries. 11 arteries supply the medulla oblongata. Yes. So it is better that you remember the artery which do not supply the medulla oblongata, which is superior cerebellar artery, rather than remembering 11. Arteries which supply the medulla oblongata. But anyway, if you say superior cerebellar artery do not supply the medulla oblongata, fine. But can you tell me the 11 arteries supplying medulla oblongata just for the information's sake? Yes, I'll tell you. Do you remember? Medulla oblongata is supplied by the basilar artery when you are talking about upper medulla. Okay, If you say upper medulla is supplied by basilar artery, who else is supplying? The 2 ica and the 2 pica. So 2 ica, 2 pica supply medulla oblongata. Yes. And also the 2 vertebrals. Also the 2 anterior spinal. Also the 2 posterior spinal. Can I enumerate them again? Yeah, let us enumerate. You have to understand. Medulla oblongata. Yes. When you're talking about the medulla oblongata, it is supplied by 11 arteries, namely, number 1, basilar artery. And then there are 2 ica and there are 2 pica. 2 ica, 2 pica, yes. And 2 vertebral, yes. 2 anterior spinal arteries, yes. And 2 posterior spinal arteries also. Both came from the vertebral artery only. Then ica came from basilar, yes. Pica came from the vertebral, yes. That is okay, but this is how it is. So you're telling medulla oblongata is supplied by 11 arteries, 1 basilar, yes. And it gave the 2 ica, which is also by medulla, yes. And then the 2 pica given by vertebral are supplying the medulla, yes. 2 vertebral itself supplying medulla, yes. And the vertebral artery giving 2 anterior spinal, 2 posterior spinal. All of them, yes, 2, 4, 6, 8, 10, 11 arteries. But instead of having 11 arteries supplying medulla oblongata, which is very frequent question in the exams, All India PG, DNB, AIMS, PGA Chandigarh, JIPMER, NIMHANS. Remember one thing, superior cerebellar artery is not supplying medulla oblongata. That is better. Sometimes one negative statement is better than 11 positive statements. Okay, anyway, now basilar artery has reached the midbrain. What is it doing? As the basilar artery will reach the midbrain, it will bifurcate into 2 branches. What are the names? As the basilar artery will reach the midbrain, it will bifurcate into 2 branches. The names are actually called as the, yes, posterior cerebral artery. Yeah, posterior cerebral artery. And posterior cerebral artery will supply the posterior cerebrum. So these are the posterior cerebral arteries now. Yes, remember, the basilar artery will divide into 2 posterior cerebral arteries supplying the posterior cerebrum, and posterior cerebrum has occipital visual cortex, which is also called striate cortex. Why it is called striate cortex? Because it is having striations of Jenari. You remember? Striations of Jenari. Are you trying to say that the posterior cerebral artery supply the striate cortex? Yes, because striate cortex is actually the occipital visual cortex, which is in the posterior cerebrum. So posterior cerebral artery supply posterior cerebrum, including occipital visual cortex and the striate cortex. Yes. Okay. If you say so, I have a problem. What problem you have? I have a block in the right-sided posterior cerebral artery. Discuss that. Okay, that we will discuss. But before you discuss that block in the posterior cerebral artery and cortical blindness, before that, just put some more information. Why? What is left? What is left? You just showed this is thalamus. Thalamus, yes. Okay, thalamus then. Who is supplying thalamus? Who is supplying thalamus? Many arteries. Can you name some? Few. Okay. Posterior cerebral arteries supply midbrain and also thalamus. So posterior cerebral artery supplying midbrain and thalamus, yes. But you told that midbrain is supplied by branches of the basilar artery. Yeah, of course. Basilar arteries supply the midbrain, but along with that, it is also supplied by posterior cerebral artery. So midbrain having double artery supply. Yes, you can say that. The midbrain is having double artery supply now. Few branches of basilar artery and few branches of posterior cerebral artery. And posterior cerebral artery is also supplying. Posterior cerebral artery is also supplying the thalamus. Okay, who else is supplying thalamus? There are many arteries. We'll discuss one more. But at this moment, tell. This is the internal carotid artery giving a branch called posterior communicating artery to anastomose with. Tell. This is internal carotid artery which is giving posterior communicating artery to anastomose with posterior cerebral artery contributing to circle of Willis. So this is internal carotid artery, which is giving posterior communicating artery, which is in anastomosis with posterior cerebral artery to make the circle of Willis. Yes, what if circle of Willis has a berry aneurysm here? Where? On the circle of Willis, posterior communicating artery. If you have a berry aneurysm on the circle of Willis on the posterior communicating artery, then which is the most commonly damaged nerve? Most commonly damaged nerve, oculomotor, coming from midbrain. So midbrain is giving you oculomotor nerve. And when the midbrain was giving you oculomotor nerve, that is sandwiched between the two arteries. Which two arteries sandwich the third nerve? This posterior cerebral artery and superior cerebellar artery. Remember, when the third nerve came from the midbrain, it was sandwiched between the posterior cerebral artery and superior cerebellar artery. Not only the third nerve, but also fourth nerve. So fourth nerve is also coming from midbrain. Yes, both are sandwiched between the two arteries. You're telling nerve number 3, 4 come from the midbrain. Yes, midbrain. And they're sandwiched between two arteries, namely the posterior cerebral and superior cerebellar. Yes. What if they have aneurysm? Oh, the superior cerebellar and posterior cerebral. If they have aneurysm, the superior cerebellar and posterior cerebral, most commonly third nerve is involved, not the fourth. It will escape. So you mean to say if you have aneurysm on superior cerebellar artery or the posterior cerebral artery or this posterior communicating artery, 3 arteries compressing the third nerve by their aneurysm? Yes, 3 arteries compressing the third nerve by their aneurysm. Now that you remember. 3 arteries compressing third nerve by their aneurysm. Not the fourth nerve? No, fourth is rarely involved. Third is more commonly involved. Now, if you have given all that information, give one more. The posterior communicating artery is supplying thalamus. Now, thalamus has 2 arteries supplying. So, posterior communicating artery supply thalamus? Yes. And now thalamus has 2 arteries supply? Yes. What is the other one? Other one is the posterior cerebral artery. So, posterior cerebral artery, posterior communicating artery, and many more will supply thalamus. Many more will supply thalamus. You have seen only 2 of them here. Okay. What about that cortical blindness you were talking about? Yeah, okay. This is a block in the right-sided posterior cerebral artery. When there's a block in the right-sided posterior cerebral artery, there will be cortical blindness. What is cortical blindness? You will find the patient is having contralateral homonymous hemianopia. What is this contralateral homonymous hemianopia? What is that? Actually, when there is a block in the right-sided posterior cerebral artery, yes. Right-sided posterior cerebral artery is blocked, yes. There will be contralateral homonymous hemianopia. What is that? Explain. What is that? Let me discuss that now. You see, the Eiffel Tower here. Eiffel Tower, yes. Paris, France, yes. Yeah, I can see Eiffel Tower. But this patient cannot see. Which patient? The one who is having right-sided posterior cerebral artery block. Oh, there is a right-sided posterior cerebral artery block now? Yes, this patient cannot see the Eiffel Tower. Why? Because left half of each eye is blind. You mean to say left visual field is gone? Yes. You mean to say that the left temporal field and right nasal field is gone? Yes. Left temporal and right nasal is gone. Where is the block? Right-sided posterior cerebral artery. And which visual field is lost? Contralateral, left side. You mean to say temporal vision of left eye and nasal vision of right eye is gone. Can you explain that in some diagram now? Yes, let us do that. Look at the patient from the superior view. This is CT scan. You have put the patient CT scan. Look at the superior view of brain. Superior view of brain. Yes. Nose is anterior. Yes, nose is anterior. Look at the superior view of the eyeballs. Which eyeball? The right eyeball and the left eyeball. So looking at the right eyeball, left eyeball, this is superior view. Yes. Nose is anterior. Yes. Okay. Then you have a patient who has block in the right-sided posterior cerebral artery. So if there's a block in the right-sided posterior cerebral artery, then what is the problem? Problem is there is the left visual field gone. What is this left visual field gone? What is this? contralateral homonymous hemianopia. What is this contralateral homonymous hemianopia? Tell me. You see, the temporal vision of the left eye and nasal vision of the right eye is gone. What is that? Temporal vision of the left eye and nasal vision of the right eye is gone. Left visual field is gone. See here, this patient cannot see the Eiffel Tower. Why the patient cannot see the Eiffel Tower? Because left half of each eye is blind. Contralateral homonymous hemianopia. Okay, fine. Explain that in the diagram then. Normally, left temporal vision comes to nasal retina and cross the midline optic chiasma and go to the opposite brain. Tell again. Left temporal vision comes to nasal retina and cross in the optic chiasma to go to the opposite brain. And what about the right nasal vision? Right nasal vision is going to temporal retina and go to the same side of brain. Means, see, right nasal vision go to the temporal retina and to the same side of the brain, So you can see I have some ischemia here. Then you can understand. Left temporal vision is gone. Right nasal vision is gone. Left half of each eye is blind. Contralateral homonymous hemianopia. That is the problem. Contralateral homonymous hemianopia. Yes. Left temporal vision is gone. Right nasal vision is gone. That is the point here. Okay, what if I have right optic nerve injury? If you have right optic nerve injury, right eye is blind. And what if I have a pituitary tumor, midline tumor? If you have a pituitary tumor, midline tumor, this is bitemporal hemianopia. Temporal vision on each eye is gone. There is a tunnel vision. So telling that if there is a midline tumor, there is an injury to optic chiasma? Yes. And when there is injury to optic chiasma, there is bitemporal hemianopia, means both the temporal vision are gone? Yes, only nasal vision is there. So, tunnel vision. Yes, tunnel vision. Pituitary tumor is a midline tumor and result in tunnel vision, bitemporal hemianopia. And what if I have injury here? Then it is the same as the patient which you have discussed. You mean to say contralateral homonymous hemianopia? Yes, they are the same. But there will be one difference. If you have injury of the optic tract, they are the same patient. If you have injury of the optic tract, there will be same type of patient. Means contralateral homonymous hemianopia. But there is one difference. What is one difference? Let us see what is the difference. Actually, in our patient who has right-sided cortical blindness, there is a macular sparing. Central vision is working. Why macular sparing, central vision working? Why macular sparing, central vision working? Because it is written by Harrison. What is Harrison writing? That the macular area on the brain has blood supply from middle cerebral artery and middle cerebral artery is still working. So macular area is still working. Central vision is still working. So telling this is contralateral homonymous hemianopia. Contralateral homonymous hemianopia with the macular sparing. Yes, but why the macular sparing? Why the central vision still working? Because the macular area on the brain has supply from Middle cerebral artery. Then which artery was blocked here? Posterior cerebral artery, not the middle cerebral artery. Middle cerebral artery working. We'll see that in a diagram shortly. But it is a case of contralateral homonymous hemianopia with macular sparing. If you have a block in posterior cerebral artery, cortical blindness. Okay, if you say so, fine. We have to look at this part of the diagram then, which is about the circle of Willis. If you say about the circle of Willis, you were talking about what in the before discussion. Actually, we have to reach the circle of Willis now with some basic idea. So, do you have the basic idea now? Yes, we have. Let us go there. See, internal carotid artery give you 5 branches. Tell me the name of 5 branches. Internal carotid artery giving 5 branches. I know one of them. Which one you know? I know the posterior communicating artery. Posterior communicating artery is a branch of the internal carotid artery. Yes, it is anastomosing with posterior cerebral artery contributing to circle of Willis. Number 2, it is actually middle cerebral artery going to lateral sulcus of brain. Lateral sulcus of brain. And number 3, it is ophthalmic artery. Where is it going? Into the orbit supplying the eyeball. Ophthalmic artery going to orbit supplying the eyeball. Number 4, it is the anterior cerebral artery supplying the anterior cerebrum. Anterior cerebral artery supplying anterior cerebrum. Yes. And number 5, posteriorly going anterior choroidal artery. Anterior choroidal artery. So you are telling anterior choroidal artery, 5 branches of internal carotid artery. Name the 5 branches of internal carotid artery again. See, there is one posterior communicating artery anastomosing with posterior cerebral artery, and then there is a middle cerebral artery going to lateral sulcus of brain, and then there is ophthalmic artery entering the orbit to supply eyeball, and then there is anterior cerebral artery supplying the anterior cerebrum, and then there is anterior choroidal artery. Do you remember anterior choroidal artery supply the internal capsule? Can you tell me which part of internal capsule? If you remember, we have discussed one syndrome, Ames question. They were asking, anterior choroidal artery blocked, there is a syndrome. Which part of the internal capsule compromised? Remember? It supplied the posterior limb of internal capsule. Do you remember that? We will discuss internal capsule again, arterial supply. But remember, anterior choroidal artery is supplying posterior limb of internal capsule. Then who was supplying the genu of internal capsule? A direct branch of internal carotid artery. Do you remember that? A direct branch of internal carotid artery will supply the genu of internal capsule. Then who will supply the anterior limb? That we'll find out by drawing a diagram. At this moment, just tell me the 9 arteries making circle of Willis. 9 arteries making circle of Willis. Yes. Okay, let us count. 2 posterior cerebral arteries and 2 posterior communicating arteries and 2 internal carotid arteries and 2 anterior cerebral arteries and 1 anterior communicating artery. So total 9 arteries making circle of Willis. So what are the 9 arteries making circle of Willis? They are 2 posterior cerebral and 2 posterior communicating and 2 internal carotid and 2 anterior cerebral and 1 anterior communicating. Where is the berry aneurysm more commonly seen? Mostly anterior circulation. How much? 40% incidence. If you say 40% incidence in the anterior communicating artery, then what is the incidence in of the berry aneurysm in the posterior communicating artery? The incidence of berry aneurysm in the posterior communicating artery is half, 20%. So there is 40%, yes, and here it is 20%, yes, half, almost. Berry aneurysm, yes, circle of Willis. So this is a diagram taken from Pathology Robbins. It will not match with Bailey Love surgery. This is a diagram from Pathology Robbins which is not matching with Bailey Love surgery. Why? What is Bailey Love surgery doing? That we will not follow. We'll just follow pathology because I have seen many books and they match Pathology Robbins. What they are matching? Actually, there is 40% incidence anterior communicating artery berry aneurysm and 20% incidence posterior communicating berry aneurysm. Just remember like that. And what is the next thing? Next thing, you have to discuss the internal capsule artery supply. You remember internal capsule is a V-shaped arrangement of axons. Who is supplying the posterior limb? The posterior limb of internal capsule, I know. Yeah, tell me. Tell me also. It is this. Which one? Anterior choroidal artery. So anterior choroidal artery branch of internal carotid artery is supplying the posterior limb of the internal capsule. Then who is supplying the anterior limb? Anterior limb of internal capsule. Yes. Anterior limb of internal capsule is obviously supplied by anterior cerebral artery. Now when you say anterior cerebral artery supplying the anterior limb of the internal capsule, which branch? Which branch? It will give some branch which is called as Hübner artery. What is that? Hübner artery, recurrent branch of Hübner. So recurrent branch of Hübner, yes. So there is some recurrent branch of Hübner which will be given by anterior cerebral artery supplying anterior limb of internal capsule. Then who is supplying the genu? Genu, the bend, yes. You know that. You already know. What? Direct branch of internal carotid artery. So direct branch of internal carotid artery supplying the genu. But do you know one thing? Which is the major artery to supply internal capsule? You have not discussed it yet. We have not discussed the major artery to internal capsule. No. Then who is that? That is actually middle cerebral artery. How the middle cerebral artery is the major artery to internal capsule? Because it supplies anterior limb, posterior limb and the bent genu also. Remember one thing. Internal capsule has two parts. There is upper dorsal part and there's a lower ventral part. So internal capsule has two parts and there is some upper dorsal part and there is a lower ventral part. Yes. The upper dorsal part is supplied by middle cerebral artery. You're telling that internal capsule has two parts. Yes. There is the upper dorsal part which is supplied by middle cerebral artery. And who is supplying the lower ventral? Lower ventral, you already have discussed three branches. Let us draw a diagram and then understand that. But understand that the upper dorsal part may be anterior limb, posterior limb of the bend is supplied by middle cerebral artery. And middle cerebral artery also, which branch of middle cerebral artery? The middle cerebral artery, that branch which is supplying the lentiform nucleus and the striate nucleus. What is striate nucleus? See, this is lentiform and this is caudate. You remember? Striatum. Oh, this is lentiform nucleus which is lateral to the internal capsule. Yes. Basal ganglia. So this is lentiform nucleus which is lateral to internal capsule, the basal ganglia. What is this? Striatum. Striatum, you know, caudate and putamen is striatum. Caudate and putamen is striatum. So, middle cerebral artery was supplying basal ganglia by giving lenticulo-striatal branches. Which one? Lenticulo-striatal branches and lenticulo-striatal branches of middle cerebral artery which supply basal ganglia also supply internal capsule. Which part? Upper dorsal part. Why? Who is supplying the lower ventral? Lower ventral will draw the diagram and discuss. But this is upper dorsal. Let me show you a diagram here. What is this diagram? This diagram will tell you this is the lentiform nucleus. If that is the lentiform nucleus, I think it is lateral to internal capsule. Yes, you can show the internal capsule here. This is internal capsule now. If that is the internal capsule, fine. Where is the caudate nucleus? Caudate nucleus is here. Here. So that is caudate nucleus. Yes. Where is thalamus then? Thalamus. Thalamus will be here. This is thalamus. So that will be thalamus. Yes. Okay. What do you want? What I want is to discuss the artery supply to basal ganglia. You mean to say lenticulostriatal? Yes, this is striatal. This is striatal. This is striatal. Caudate plus putamen. Yes, that is caudate plus putamen. This is caudate plus putamen. So if you say this is caudate plus putamen, this is lentiform, lenticulostriatal branches. Can I see the lenticulostriatal branches then? Yes, you see them. See, this is internal capsule. Okay. This is the middle cerebral artery. Who is giving that? The internal carotid artery. Where is that? This is internal carotid artery. So this is internal carotid artery now giving the middle cerebral artery. Where is the middle cerebral artery going? To the lateral sulcus of brain. And when it is going to the lateral sulcus of brain, it was giving lenticulostriatal branches to the basal ganglia. And that is the one which is supplying upper dorsal part of internal capsule. Upper dorsal part of internal capsule. Now, if it is supplying the upper dorsal part of internal capsule, who is supplying the lower ventral then? That we will discuss by drawing a diagram. So, this is your diagram now. Yes. You want to supply internal capsule then? Yes. Okay, then do it. Okay, let us do it. See, if you remember, there are two vertebral arteries ascending up. Yes. And then they join to form the basilar artery. Yes. And then they bifurcate to form the posterior cerebral artery. Yes. There are two vertebral arteries ascending up, and then they join to form basilar artery, which will then divide into two posterior cerebral artery and receiving a branch of internal carotid artery. Which branch of internal carotid artery? Internal carotid artery is here on each side, giving 5 branches. What 5 branches it was giving? Which branch was coming posterior? It was this. Who is this? That was the posterior communicating artery. If you say this is the posterior communicating artery, that is the branch of the internal carotid artery contributing to circle of Willis? Yes. What are the other branches? Other branches, there is this middle cerebral artery. If you say this is the middle cerebral artery, I think this is the middle cerebral artery, which is going to give us some branches to the internal capsule. Yes, they are called lenticulostriate branches to internal capsule. Not only internal capsule, but also basal ganglia. Lenticular and striatal nuclei of basal ganglia. Okay, fine. What is other branches? Other branches, you see, this is anterior cerebral artery and it will supply anterior cerebrum. If that is the anterior cerebral artery supplying the anterior cerebrum, then what about the others? Others, what others? You had some more. You are talking about the orbital artery? Yeah, orbital ophthalmic. So orbital ophthalmic artery. Yes. One more was there. Which one is there? There is one more. Yeah, one more. Which one? You remember there was this anterior choroidal artery. Now, once you have shown the anterior choroidal artery also, let us supply the internal capsule. As you are supplying the internal capsule, I have told you internal capsule has 2 parts. What are the 2 parts of internal capsule? Actually, there is upper dorsal. And who is supplying the upper dorsal? The upper dorsal is supplied by middle cerebral artery. Which branches of middle cerebral artery? Lenticulostriatal branches. So you're telling this is internal capsule? Yes. I think this is the bent genu. Yes, the bent genu here and there. And then it is having some upper dorsal part. Yes. And this upper dorsal part I'll shade. Yeah, you shade, no problem. So this is the upper dorsal part which I'm shading. Maybe the anterior limb, posterior limb, or the bent called genu is the same artery which is called middle cerebral artery. Lenticulostriatal branches. Yes, lenticulostriatal branches of the middle cerebral artery which was supplying the lentiform nucleus and also the striate nucleus of basal ganglia. So you're telling there is some lentiform nucleus which is lateral to the internal capsule. Yes. And then there is some striatal nucleus here. Yes. And lenticulostriatal branches of the middle cerebral artery supply the basal ganglia and upper dorsal part. Who is supplying lower ventral? Let us see who is supplying lower ventral. Lower ventral part of internal capsule. So when you're looking at the lower ventral part of the internal capsule, you already know what? That this is one artery. Who is that? A recurrent branch of Hubener. You are telling that anterior cerebral artery supply anterior limb of the internal capsule. Yes, recurrent branch of the Hubener. So there is some recurrent branch of Hubener. Yes, and which is supplying the anterior limb of, who is supplying the genu? Direct branch, internal carotid artery. Direct branch internal carotid artery. So you have a direct branch of internal carotid artery supplying the genu of the internal capsule. Yes, but only the lower ventral part of internal capsule. And who is supplying the posterior limb? You know already. And that is the anterior choroidal artery. Now, when this anterior choroidal artery is supplying the posterior limb, it will also supply retrolentiform fibers of the internal capsule. Is a question. Are you talking about the anterior choroidal artery here? Yes. And which is supplying the posterior limb of internal capsule? Yes. Not only posterior limb of internal capsule, but also retrolentiform fibers. So, internal carotid artery gave you the anterior choroidal artery, yes, and it is supplying posterior limb of internal capsule, yes, and posterior part of internal capsule where you have some retrolentiform fibers towards the occipital visual cortex, yes, occipital visual cortex, retrolentiform fibers supplied by anterior choroidal artery. This is about the internal capsule. You cannot remember all that until you practice this information on some MCQs. Let us do that. And this is going to be one of the MCQ. It is asking lower part. Now, if it is asking the lower part of the internal capsule, I know what? What do you know? That upper dorsal is supplied by middle cerebral and lower ventral has many arteries, like I have. Anterior limb supplied by recurrent branch of the humeral, and genu supplied by direct branch of internal carotid artery, and the posterior limb supplied by anterior choroidal artery, which also supply retrolentiform fibers of the internal capsule. Are you trying to say that this is the answer? Yes. Why? Because if you say sublentiform part, it is posterior part of internal capsule. So humeral artery supply the anterior limb of internal capsule. That's why. You are telling humeral artery is a branch of anterior cerebral artery supplying anterior limb of internal capsule. Yes. Then who was supplying the sublentiform? Sublentiform is posteriorly present. So anterior choroidal artery. Anterior choroidal artery. Yes. So you mean to say anterior choroidal artery supply the sublentiform part, the posterior part of the internal capsule? Yes, I told you. Anterior choroidal artery supply posterior limb of the internal capsule, and this is on the posterior limb. Sublentiform, retrolentiform. So sublentiform, retrolentiform, posterior limb of internal capsule supplied by anterior choroidal artery. Yes, branch of internal carotid artery. Choice number D is wrong. That is the answer. Keep that answer. Because sublentiform part is posterior part of internal capsule and humeral artery supply anterior limb of internal capsule. This is a mismatch. That is the answer. If you say so, fine. We'll keep the answer then. What about this one? So we are keeping this answer now and this is one diagram which we already have seen, the circle of Willis. In the circle of Willis, what we want to know is when the vertebral arteries join to form basilar artery, divide to form the posterior cerebral artery, supply posterior cerebrum. And when the internal carotid artery is giving middle cerebral artery and the anterior cerebral artery, what are they doing? What are they doing? Yes. Anterior cerebral artery will supply the anterior cerebrum, and what is the middle cerebral artery doing? It will supply the lateral cerebrum. What is lateral cerebrum? I don't know what is lateral cerebrum. So there is anterior cerebrum supplied by anterior cerebral artery. There is lateral cerebrum supplied by middle cerebral artery, and then there is posterior cerebrum which is supplied by posterior cerebral artery. This is one diagram which you want to discuss. And see, this is internal carotid artery. Yes, it is giving anterior cerebral artery. It is supplying the medial cerebrum. Major artery on medial cerebrum is anterior cerebral artery. It will supply this paracentral lobule, lower limb area. If you remember, there was a lower limb area, paracentral lobule, the homunculus. If you block this artery, lower limb sensory motor loss. You are telling this is the internal carotid artery giving anterior cerebral artery and supplying the medial cerebrum, major artery and medial cerebrum? Yes. And supplying paracentral lobule, the lower limb homunculus? Yes. Part of pelvis perineum also. Part of pelvis perineum also. You mean to say if I have a block in the anterior cerebral artery, there will be lower limb involved? Yeah, part of pelvis perineum, but contralateral body, contralateral body. Okay. Can you tell me what is this two vertebral artery doing? Actually, they join to form basilar. And what is the basilar doing? It is giving posterior cerebral. What is posterior cerebral doing? It is supplying occipital visual cortex. So you're telling these are the two vertebral arteries, they join to form basilar artery and give posterior cerebral artery supply the occipital visual cortex. Yes. What if you block it? If you block it, cortical blindness, contralateral homonymous hemianopia with macular sparing. But why macular sparing? Let us see. See, this is the diagram taken from Harrison medicine. What is Harrison telling? Harrison is telling something. Macular area on the brain is supplied by middle cerebral artery. That is what it is telling. So there is a middle cerebral artery. Yes. And it is giving some branch to the macular area on the brain. Yes. This is the discussion we have to talk about. Remember, lateral cerebrum, the major artery is middle cerebral artery. Lateral cerebrum, the major artery is middle cerebral artery. Let us discuss more details now. As we are discussing these details, you will see this is anterior cerebral artery, branch of internal carotid artery. So internal carotid artery is now giving anterior cerebral artery. Yes, supplying the anterior cerebrum, lateral surface of cerebrum. Yes, this is lateral surface of cerebrum, but it is majorly supplying medial surface of cerebrum. Remember, the major artery on medial surface of cerebrum is anterior cerebral artery. And who is the major artery on the lateral cerebrum? See, posterior cerebral artery is supposed to supply posterior cerebrum. If you say posterior cerebral artery is supposed to supply posterior cerebrum, will it supply the occipital visual cortex? Of course, it will supply occipital visual cortex, calcarine area, area of the calcarine sulcus, it will supply. So this is posterior cerebral artery supplying posterior cerebrum, occipital visual cortex, and also the area of the calcarine sulcus. Yes, you see here, area of calcarine sulcus. Then what about the middle cerebral? Middle cerebral, let us see, middle cerebral. Middle cerebral artery is the major artery on the lateral cerebrum, supplying the Wernicke's area and the Broca's area, etc., etc. And it is running in the lateral sulcus. Where? In the lateral sulcus. You mean to say internal carotid artery gave you middle cerebral artery? Yes. And this internal carotid artery when gave you middle cerebral artery run in the lateral sulcus. Yes, it is supplying lateral cerebrum. And then this is the diagram we are following. So let us follow the diagram. What is it about? See, this is the middle cerebral artery. Where? In the lateral sulcus of brain. What is it doing? It is giving some branch to the occipital visual cortex. Which area? That is called macular area. So you are telling that macular area on the brain is supplied by some branch of middle cerebral artery. That is why there is macular sparing in occipital cortical blindness. Yes, that's why. And this middle cerebral artery is also supplying Broca's area. If it is compromised, there will be hesitant patient to speak. Fluency is gone. Motor aphasia. And what if the branch 2, Wernicke's area involved? Then patient is very talkative and talking nonsense because comprehension of language is gone. It is sensory aphasia. And what if the branch of middle cerebral artery compromise here? Branch of the middle cerebral artery compromise here, then there will be upper body homunculus compromise. Sensory motor loss in the head and upper limb. Sensory motor loss in the head and upper limb. What about the pelvis perineum? No, not pelvis perineum. Why not pelvis perineum? Because that is where you have this artery. Who is that? Anterior cerebral artery, branch of internal carotid artery. So internal carotid artery gave you anterior cerebral artery supplying this area. Pelvis perineum? Yes. Pelvis perineum area is under anterior cerebral artery, not the middle cerebral artery. Okay, fine. What is the answer to this question? Then it is asking area number 4. Area number 4 can be on the lateral cerebrum and it also on the medial cerebrum. So when it is on the lateral cerebrum, upper body homunculus is supplied by middle cerebral artery. And when it is on the medial cerebrum, lower body homunculus is supplied by the anterior cerebral artery. This is medial cerebrum and that is lateral cerebrum. So you're telling the answer is C. Yes, because if it is lower limb, it is under the paracentral lobule and it is anterior cerebral artery territory. Pelvis perineum is also anterior cerebral artery territory. And what about the face, upper limb, trunk region? That is on the lateral cerebrum. So that is the middle cerebral artery territory. So choice C is the answer. Yeah, choice C is the answer. Keep the answer as choice number C. Now, as you have already known, quick revision of the problems. See, if the anterior cerebral artery is involved, the lower limb is compromised, including part of pelvis perineum, and there will be some bladder wobble disturbances. So pelvis perineum bladder wobble disturbances because there is a problem with the anterior cerebral artery? Yes. Paracentral lobule compromised. And what if there's a block in the middle cerebral artery? Then there will be contralateral sensory motor loss, but restricted to upper body. Lower limb will be spared. Upper body is involved, lower limb is spared. And what about the aphasia? Aphasia depends that which branch was compromised. It could be Broca's aphasia, it could be Wernicke's aphasia, it could be conduction aphasia also, where comprehension is intact and the fluency is intact. Depends upon which branch is compromised. And what about the posterior cerebral? Posterior cerebral sensory motor loss is not so evident, but aphasia, this hemianopia is evident. Do you remember when we have block in the posterior cerebral artery? Which kind of blindness? Cortical blindness. And that cortical blindness also, which type? Contralateral and homonymous hemianopia with macular sparing. So contralateral homonymous hemianopia with macular sparing. Why macular sparing? Because some part of the macula brain is supplied by middle cerebral artery. So middle cerebral artery is also supplying the occipital visual cortex. Yes, macular area. So there is a block in the posterior cerebral artery. In that case, there is a contralateral homonymous hemianopia with macular sparing. Yes, with macular sparing.